Good afternoon and welcome to the COVID-19 media briefing. We will now begin with Mayor John Tory. Go ahead, Mayor.
Thank you, Lavin. Good afternoon. We continue to make excellent progress on getting Toronto residents vaccinated. More than 84% of eligible residents are fully vaccinated and almost 88% have had at least one dose. More than 2.2 million people have been vaccinated, and our focus continues to be on making sure people have the opportunity to get vaccinated. Our vaccination effort is a true team effort, and that includes the province of Ontario, very much so all the way through. So I want to recognize the excellent news we received today, confirming that the Ontario government is providing $76 million to Toronto Public Health to support the fight against COVID-19 and our vaccination efforts. This additional one-time funding supports the extraordinary costs associated with preventing, monitoring, detecting, and containing COVID-19. With today's news, Toronto Public Health is now receiving a total of more than $167 million from the province this year in one-time funding. This is a sign of the size and the scope of the effort underway in Toronto to respond to these unprecedented times, including our monumental vaccination campaign. But I believe it also demonstrates the important cooperation underway between our governments to get people vaccinated and to bring the pandemic to an end. It shows what can be done when governments work together in common cause to protect our residents and get through these tough times. And I am proud of the work that we have done as a city to build a strong pandemic partnership with the Government of Ontario, and they have returned that effort. We know when it is easy to access the vaccines that more people will get vaccinated. And we know there are many barriers that may keep people from getting vaccinated, and we have worked to knock those down. Equity and inclusion have been the cornerstone of our vaccine engagement program from the very beginning of the vaccination period of this pandemic. Since April, more than 150 vaccine engagement teams have been helping equity-deserving communities remove barriers to accessing the COVID-19 vaccines. That same month, we launched Toronto's Accessibility Task Force on COVID-19 vaccines to ensure people with disabilities get the vaccine information and access to vaccination that they need to protect themselves and their families. Since then, the task force has helped literally thousands of Torontonians to get vaccinated, those who have differing abilities. In May, we held 2 clinics that were fully subscribed, which resulted in 2 more clinics being booked in July. And across these clinics, these ones alone, over 2,000 doses were administered. We've received a lot of positive feedback from the agencies and from people with differing abilities, mental or physical, on how easy it was to get vaccinated at one of these specific clinics. But we know there are still some factors keeping people from getting vaccinated, and we are here to help them. This week, along with Team Toronto and community groups, the Accessibility Task Force will host 4 super supportive vaccine clinics to help even more people get vaccinated. Running this Friday, Saturday, and Sunday in Etobicoke, North York, and Scarborough, these super supportive clinics are held in physically accessible locations and will support those who may, for example, have a fear of needles, or those who need to sit down while waiting, those who need a quiet space in which to get vaccinated, those who need a companion while they're getting vaccinated, or those who might need an ASL sign language interpreter. These are just some examples. I understand these are needs that people have that are entirely reasonable, and we're going to try to meet them so as to help people get vaccinated. As well, and I hope more people realize this, medical professionals and health professionals are at all clinics and will take the time, as they have been doing, to inform, to reassure, and to be responsive to those who have some hesitancy about the vaccines. They will take the time to have the discussion with you about those concerns if that is something that is stopping you from coming forward to get vaccinated. First and second doses of Moderna and Pfizer vaccines will be administered at these super supportive clinics to anyone born in 2009 or earlier. The clinics run Friday, November 5th from 4 to 8 p.m., Saturday, November 6th from 11 a.m. to 3 p.m. at the Elmbank Community Centre in Etobicoke, the Oak Ridge Community Centre in Scarborough, the St. Margaret's Anglican Church in Etobicoke, and Saturday, November 6th and Sunday, November 7th from 11 a.m. to 3 p.m. at the North York's Senior Centre. All city-run clinics are also accessible and offer accommodations. Anyone requiring an accommodation at the COVID-19 vaccine clinics across the city should alert a staff member upon arrival or at any time while they're visiting these clinics. And as a reminder, the city's Vaccine Equity Transportation Plan, launched earlier this year, is available for those who need support to travel to and from the clinics. And I offer special thanks to our partners at iRide, Scarborough Ride, and Toronto Ride for their help in helping people to get to their appointments. We're also ready to help people get their COVID-19 vaccine booster shots. More than 26,000 third doses have already been administered by Team Toronto. We've been preparing for today's announcement by the province, further opening up eligibility for third doses. There are many more options available for people to get their third dose than were available when people first started getting vaccinated. More than 450 pharmacies, for example, across the city are important partners in this team, and along with hospitals and healthcare partners and a growing number of doctors' offices. But we do have the capacity to help people get their third doses in our vaccination clinics. As Dr. Davila will explain shortly, we are opening up appointment booking at our 5 city-run vaccination clinics starting Saturday. Starting Saturday meaning that's when we'll open the booking system so that people can book the appointment to get their third dose. As a reminder, those 5 clinics that are open City of Toronto mass vaccination clinics are at the following locations: the Metro Toronto Convention Centre, the Cloverdale Mall, the Scarborough Town Centre, the Mitchell Field Arena, and the Woodbine Mall. We need to move back to an appointment-based system because we're expecting renewed demand at our clinics and we want people to be able to plan. People will be able to access the booking system Saturday morning at 8 a.m. at toronto.ca/COVID-19. Thank you in advance to those who are coming forward to get their third doses so that we're better protected as we move into the winter. Your ongoing commitment to getting vaccinated not only has helped protect you and your loved ones, it helps protect the progress we have all made getting through this 4th wave and fighting the Delta variant. We continue to achieve levels of vaccination success matched in few diverse global cities like ours. As much as I believe we have done a good job as a city government in making vaccines available efficiently and in a way that recognizes special challenges faced by many residents and communities, it is you, quite literally 2.2 million Torontonians so far, who have stepped up to get vaccinated. And now we need your help on a continuing basis to get us the rest of the way to 90% fully vaccinated. We're getting closer and closer, but we still have to work hard to get there, and we need your help. On that note, I'll ask Dr. Davila if she would offer her remarks for today.
Thank you, Mayor Tory, and good afternoon. If I may, before I commence my remarks on COVID, I would first just like to extend a very happy Diwali, one filled with happiness, prosperity, and joy to all those who are celebrating starting tomorrow. As Mayor Tory just said, we are planning for that administration of third doses of COVID-19 vaccine to newly eligible Toronto residents. This follows last week's statement on third doses from the National Advisory Committee on Immunization. While we are currently reviewing today's provincial announcement and the recommendations provided by the Ontario Ministry of Health, at Toronto Public Health, along with our healthcare partners, we were already preparing for the next phase of this vaccination campaign. With today's announcement, we now understand that new populations are eligible for a third dose of COVID-19 vaccine if at least 6 months after receiving a second dose. These newly eligible populations include healthcare workers and essential caregivers in congregate settings, individuals 70 years of age or older, and individuals who received a 2-dose series of AstraZeneca COVID-19 vaccine or Covishield. According to Toronto Public Health data, as of Monday, November the 8th, approximately 65,000 Torontonians will be eligible to receive a third dose of COVID-19 vaccine. With expanded eligibility and as part of the next phase of the COVID-19 vaccination campaign, city-run immunization clinics are returning to a booked appointment-based system. I encourage you to book an appointment when you are eligible at a location that is most convenient for you. On Saturday, at 8 a.m. through the provincial booking system, 40,000 appointments at Toronto Public Health vaccine clinics will be available. Healthcare workers can receive their COVID-19 vaccine through the hospital with which they are affiliated. Many individuals 70 years of age and older will also have the opportunity to receive their COVID-19 vaccine through many hospital clinics. Toronto residents also have the option of receiving their COVID-19 vaccine through one of more than 450 local pharmacies that are offering the vaccine as well. In addition to administering COVID-19 vaccines at city-run immunization clinics, Toronto Public Health launched its annual flu campaign this week in the city-run immunization clinics by appointment only. Residents will be able to receive their flu vaccine at the same time as a COVID-19 vaccine. If you come to a Toronto Public Health clinic for a flu vaccine and you are eligible for a dose of COVID-19 vaccine, you will be offered the COVID-19 vaccine. Likewise, if you receive a COVID-19 vaccine at one of our clinics and have yet to receive a flu shot, you will be offered a flu vaccine at the same time. I want to stress that 2 doses of COVID-19 vaccine still provides strong protection against contracting COVID-19 and against serious outcomes associated with the virus. If you are eligible for your 3rd dose, there are many options available for you. I would encourage you to get your vaccine through the channel that makes the best sense for you. If you're eligible for your 1st or 2nd dose of COVID-19 vaccine, it's even more important that you start and complete your vaccination series as soon as possible. This protection is for you, for your family, and for our entire community, especially for our younger children who are not yet eligible for vaccination. With that, I'll now turn it over to Lavin to moderate the questions.
Thank you, Dr. Davila and Mayor Tory. We will now take questions from the media. As a reminder, it is 1 question, 1 follow-up, and we can unmute you. So first up, there's Mark McAllister from City News. Go ahead, Mark.
Good afternoon, both to Mayor Tory and Dr. Davila. Obviously, before this, you had spoken about education campaigns and making sure that people are going to feel comfortable coming forward and getting those 3rd doses, as well as getting their kids vaccinated once that becomes available. Just curious if you're able to tell us how that's going, what kind of efforts have been made to this point, and how this is going to play a part once you start making appointments available.
So, Mark, I think that's an excellent question. And of course, we have had education components to the vaccination campaign from the very outset of the campaign. And this comes through a number of different channels. Certainly at Toronto Public Health, we have information available on our website. We have a hotline that is available to the public to help answer questions. And similar sorts of information and educational opportunities and resources are available through our healthcare partners who are part of the Team Toronto effort. For us at the city in particular, we also have a series of vaccine engagement teams and community ambassadors who are known entities within communities and neighborhoods all around the city. So they are service providers, some in healthcare, some more in social services, but are known to locals in their communities and seen as trusted resources for information. We make sure that those people have information that they in turn can share with members of their local community so that they are getting appropriate information, correct information, evidence-informed information around the benefits of vaccination, whether it's for themselves, whether it's a 3rd dose, whether it's for their children. We're making sure that all those channels are being well deployed. Of course, increasingly, we have primary care providers in the community, pharmacies as well, who are participating in the COVID-19 vaccination efforts. These people, too, are good sources of information around COVID-19 vaccination, and particularly for those who have very unique questions about their own medical conditions. we encourage that kind of conversation with the medical providers involved in those individuals' care so that it is tailored and unique for those particular circumstances. So these are just a few of the channels that we have available. As we approach, vaccination campaigns for the younger members of our community, we're hopeful about having 5 to 11 vaccination for 5 to 11s approved soon. We have a series of resources specifically available for this population, town halls and different sessions and opportunities for people to ask their questions over and above what I've already described. So we'll continue to work on those efforts, and of course are always listening to hear what other channels might make the most sense for our population to get informed.
Just as a follow-up, obviously you have felt the need to try and make these resources available and to try and educate people. What are your indicators at this point that there is a need for that? Do you have a sense that there might be more hesitancy when it comes to booster shots? Or, I mean, there's been lots of discussion, obviously, about people getting their children vaccinated as well. But how much more of a need is there to try and convince people to get out there and get more?
Well, Mark, I think that we have consistently heard from our vaccine engagement teams, our community ambassadors, our local partners on the ground, that people are interested in getting information. And I would encourage that. This is a healthcare intervention. I think it's important that people feel that it's okay. It's more than okay. It's actually quite reasonable to raise questions and to actually engage in conversation around your unique circumstances and what your concerns are. There is, unfortunately, misinformation. There's lots of channels out there, through the internet and the other social media channels that are available. And unfortunately, not all the resources that are readily available to the public are equally reliable. So we have heard from our community partners, from our vaccine engagement teams, that there are unique questions, and they may vary from community to community. So we're seeking to address those questions in the channels and with the kinds of information that people need to make good decisions around their health and to feel that they've got their questions answered and to continue that kind of conversation. I think that's really important.
Yeah, I just say, Mark, as the non-doctor here, the main hurdle we had to get over is to get people to get vaccinated. And of course, we've done very well at that, 2.2 million people that have got vaccinated, and we will be approaching 90%, which is a huge accomplishment for us. I think a lot of people who have had vaccinations over time of different kinds are quite used to the concept of a booster shot. They know that with regard to other kinds of injections they have on a routine basis. And I think what we're more likely to get, and this is where Dr. Davila is right, we're going to have the information available, is questions that relate to, as it has been the case before, what if I had one of these and one of those, and when did I have my last one, and how do I tell, and the kinds of questions that are very basic, not on the principle of whether you should get a booster shot. There'll be some of those, but more the details as to how to get it done and what a booster shot's all about and so on. But I think they're quite familiar with the concept of a booster shot, and I think that will help us, especially in light of the fact that millions of people quite literally have got themselves over the hurdle of getting the vaccination not once but twice, and now will understand, I think, the concept of a booster shot.
Thank you, Mark. Next up, we have Dave Ryder from the Star. Go ahead.
Hi, everybody. First question for Dr. Davila, and that is, since we saw the CDC in the U.S. Give the green light for vaccine for kids 5 to 11, and I think you mentioned about timing. Last we heard from you, you expected it to be weeks before we might see it approved and kids able to get their shots here. Do you have any more detail on that, or anything else about the program as to where parents are going to take their kids, or anything else on kids getting booster shots?
So, David, I don't have more specific information in respect of dates. We are still hopeful that we are on the order of weeks away in respect of getting an approval from Health Canada. And certainly having that approval come in the United States is something that we're all looking at. And I'm sure that the federal partners who are responsible for approving vaccines here are obviously keeping an eye on that which happened in the United States. So we are still hoping to see the ability to give this vaccine, to offer that protection to the youngest members of our community sooner rather than later, and in the next coming weeks, as I said earlier. With respect to where vaccines might be available, we, as I have mentioned, have been preparing and planning with our healthcare partners around making sure that channels are broadly available and channels that actually really meet the needs of our families throughout the city. So we know that some children in particular are going to be more medically complex. We have, fortunately, here in the city, pediatric specialty hospitals and clinics that are able to support the delivery of vaccine to those particular populations. We have our hospital partners that have been crucial to us in the vaccination campaign, not just our pediatric partners, but just the community hospital partners as well. We have certainly our Toronto Public Health Clinics. We have a number of community care providers. We have pharmacies that are coming on board with respect to providing COVID-19 vaccine, and that number continues to grow. And of course, as part and parcel of our vaccine campaign for the youngest members of our community, we are working on having many school-based clinics available because those are convenient. They're well located in the community. They're familiar to families and to children in our communities. So that is going to be a channel, and we've heard that that is a channel that many parents are interested in using in terms of getting their children vaccinated. We still have a survey that's out there surveying our parents to find out what they're most interested in, what channels make sense, what their thoughts are around vaccinating their 5 to 11-year-olds. As we get those data, we're going to continue to use those to support our planning efforts to make sure that we're meeting the needs as best we can.
Thank you. My follow-up is for Mayor Tory, and that's I'm hoping we can get an update on the vaccination mandate for city employees. I'm hearing that some employees, after they've met with their supervisors, have been suspended. City staff, for some reason, are saying maybe till Friday they won't be able to confirm or deny that. Can you give an update if that's happening, which departments, what numbers, and if you're seeing many people at the last minute decide to get vaccinated rather than face suspension or possible dismissal?
Dave, thank you for the question. I won't comment on that today in terms of the answers specifically to those questions, except to say that we are, I think as you know, at 98% fully or partially vaccinated from among our city employees as a whole group, 30,000+ of them, and we're at 99% that have disclosed their status. And we decided, the city administration, public servants did, that the way they would report on that would be on a weekly basis as opposed to every hour of every day. As these meetings go on across the city, it's a wide-ranging organization that's spread across different locations, and there are interviews taking place with those employees who have indicated either that they won't disclose or that they won't be getting vaccinated, or at least up until now. So we will give a full report on that and be transparent about it, but again, our focus continues to be on convincing as many people as possible to get vaccinated, and these numbers that I mentioned are very heartening indeed.
Okay, and then Jane Stevenson, we've unmuted you. Did you end up having a question?
Yes, please, for Dr. Davila. You were speaking about the fact that when people get the COVID vaccine, they can also opt to get the flu shot, providing they're eligible, I guess, in both areas. Just because there's been a lot of vaccine hesitancy in general, are you concerned that people might go, oh, you know, there might be a double whammy of day after effects, and should people not be concerned about that?
So thanks for the question, Jane. I can tell you that the National Advisory Committee on Immunization actually did look at this issue and is recommending that it is safe and effective to actually get the COVID-19 vaccine and the flu vaccine at the same time. As you've probably heard me say before, one, it's important to get COVID-19 vaccine at this point in time, and particularly for those who have yet to receive a dose of COVID-19 vaccine. You know, I'm sure as they get informed around the protective benefit of COVID-19 vaccine, as they have the opportunity to get their questions answered, they will realize that there's good benefit to getting this vaccine for themselves and for everyone around them. The influenza vaccine is particularly important this year, given that there wasn't much influenza last year, and there is the potential for significant impact of influenza. And we know that in previous years, influenza has wreaked havoc on our society, and in particular on the burden on our healthcare system. And clearly, we're eager to prevent that from happening. We know that these two vaccines can be safely administered at the same time, and for some people, that may just be a question of convenience. One stop, one visit to a clinic, two vaccines, good protection against influenza in the case of flu vaccine, and when you get a complete series for COVID-19 vaccine, good protection against COVID-19 as well. So for those for whom time is an issue and convenience is a question, then clearly getting both vaccines, assuming that they're eligible, is a good thing.
And can you also just speak to the issue of vaccine hesitancy at this point in the game of trying to get to this 90%? Do you guys have a sense of where the hesitancy remains? Is it education? Is it medical concerns? What's kind of the leading cause of hesitancy at this point, if I can put it that way?
Well, Jane, first and foremost, as the mayor just said, I think we have to look at this as a more glass half full perspective. We have a significant proportion of our population that has already taken up vaccine. Just shy of 88% with at least one dose on board, and about 84% now that has fully vaccinated, 2 doses on board at this point in time. And this in a relatively short period of time. So I think overall as a community, what we are seeing is great confidence in COVID-19 vaccine, and frankly, we're reaping the benefit of that. We have seen our COVID-19 indicators trend downwards, and they've remained quite steady and low for a number of weeks now, and vaccination clearly plays a big role in that. But, I think the reasons for hesitancy are as unique as the individuals throughout our community. Some have some very unique medical conditions and experiences with the medical system themselves that make them a little more reluctant around adopting new interventions. Some are, unfortunately, picking up misinformation and actually adjusting that or changing their mind around misinformation does take some time. But we are seeing when people do have the opportunity to have their questions answered, right, to engage in respectful discussion around what are the concerns and what is the actual science behind the vaccine and what is the correct information around their unique medical situation, we find that more and more people do get vaccinated because they're seeing the benefit of vaccine from those around them, and they're also actually witnessing the safety of the vaccine from those around them.
I just want to make a short comment on that. When we have called people, for example, of which there were thousands who'd had their first dose and not their second, you also had, beyond the concerns about medical situations and whatnot, you had a huge number of people, 30% of the phone calls they made, people said they just had a scheduling issue. And, that can sometimes mask other kinds of concerns. But the bottom line is one of the reasons we're having clinics at different places where people are and at different hours of the day and making sure they're accessible and so on is to make sure that we address, what can often be something as simple as a scheduling issue. For a large number of people that we phoned, thousands of them, they said that that was the case. And I think we should remember as we go forward, and it's part of this, I would say the glass is approaching 90% full, not half full, that, we're approaching, we're at 84% now of people who've been double vaccinated, and, we'll get to 90%, and to get 90% of the people of this city on any given day to agree on what month it is sometimes is a challenge, just because people have different opinions about all kinds of things, different perspectives, and this campaign has been already a monumental success, but we've got to get the rest of the way there. But there are a variety of reasons, some of them very practical, and that's why we're trying everything we can in terms of malls and TTC stations and different times of the day and different times of the week to make it possible for people to get vaccinated, which they're doing. It's just in smaller numbers now, 10 at a time, 50 at a time, 100 at a time, instead of thousands at a time.
That's it for today, everybody. Have a great rest of your week. Thank you.